Keflex, also known as Cephalexin, is a widely prescribed antibiotic that belongs to the cephalosporin family. It has been a trusted medication for decades, offering effective treatment for various bacterial infections. In this comprehensive video, we will delve into the common purposes of Keflex, its advantages, potential side effects, dosage recommendations, and dangers, providing you with a thorough understanding of this widely used antibiotic. What is Keflex used for? Keflex is primarily used to combat bacterial infections caused by susceptible strains of bacteria. Its broad-spectrum nature makes it effective against a wide range of infections, including common purposes of Keflex. Respiratory tract infections. Keflex is commonly prescribed for respiratory tract infections such as bronchitis, pneumonia, and sinus infections. It can effectively treat infections caused by bacteria like Streptococcus pneumoniae and Haemophilus influenzae. Skin and soft tissue infections. Keflex is effective in treating skin and soft tissue infections like cellulitis, impetigo, and abscesses. It can combat infections caused by Staphylococcus aureus and Streptococcus pyogenes. Urinary tract infections, UTIs. Keflex is frequently prescribed for uncomplicated urinary tract infections, including cystitis and pyelonephritis. It can effectively treat infections caused by Escherichia coli and other susceptible bacteria. Ear infections. Keflex is sometimes used to treat ear infections, particularly those caused by Streptococcus pneumoniae or Haemophilus influenzae. Bone and joint infections. In certain cases, Keflex may be prescribed for bone and joint infections, such as osteomyelitis or septic arthritis. Advantages of using Keflex. Keflex offers several advantages that contribute to its widespread use. Broad-spectrum activity. Keflex is effective against a wide range of gram-positive and gram-negative bacteria, making it a versatile antibiotic. Its broad-spectrum activity allows it to treat various types of bacterial infections. Oral administration. Keflex is available in oral formulations, making it convenient for patients to take it home without the need for injections or hospital visits. This ease of administration contributes to better patient compliance and adherence to treatment. Favorable safety profile. Keflex is generally well tolerated and has a relatively low risk of serious side effects when used as directed. It is considered a safe option for many patients, including children and pregnant women, with caution. Availability and cost-effectiveness. Keflex is widely available and relatively inexpensive compared to some newer antibiotics. This makes it an accessible treatment option for many patients and healthcare systems. Potential side effects of Keflex. Like all medications, Keflex can cause side effects, although most are mild and resolve once treatment is completed. Common side effects of Keflex may include gastrointestinal disturbances, nausea, vomiting, diarrhea, or abdominal discomfort, allergic reactions, rash, itching, or difficulty breathing. Seek immediate medical attention if these occur. Headaches. Mild headaches may occur during treatment. Vaginal yeast infections. Keflex can disrupt the natural balance of vaginal flora, leading to yeast infections in some women. Rare but more serious side effects may include Clostridium difficile-associated diarrhea, kidney or liver problems, blood disorders, e.g., low white blood cell count, low platelet count. It is essential to report any concerning side effects to your healthcare provider promptly. Dosage recommendations for Keflex. The appropriate dosage of Keflex depends on various factors, including the patient's age, weight, and the type and severity of the infection. It is crucial to follow your healthcare provider's instructions carefully and complete the entire course of treatment, even if you start feeling better. Here are some general dosage guidelines for Keflex. Adults. The typical adult dosage ranges from 250 mg to 1 gram, taken every 6 to 12 hours, depending on the infection type and severity. For severe infections, higher doses may be prescribed. Children. Dosage is based on the child's weight and age. Common dosages range from 25 mg per kilogram to 100 mg per kilogram per day, divided into 2 to 4 doses. Elderly patients. Dosage adjustments may be necessary for elderly patients with impaired kidney function. Lower doses or extended dosing intervals may be recommended. It is essential to follow the prescribed dosage and duration of treatment to ensure the best possible outcome and prevent the development of antibiotic resistance. Dangers and precautions of using Keflex. While Keflex is generally safe when used as directed, there are some dangers and precautions to be aware of. Allergic reactions. Keflex can cause allergic reactions, ranging from mild rashes to severe, life-threatening anaphylaxis. Patients with a known allergy to cephalosporins or penicillins should avoid Keflex. Antibiotic resistance. Inappropriate or excessive use of antibiotics, including Keflex, can contribute to the development of antibiotic-resistant bacteria. It is crucial to follow the prescribed dosage and duration of treatment to minimize the risk of resistance. Clostridium difficile-associated diarrhea. Keflex, like other antibiotics, can disrupt the natural balance of gut bacteria, leading to Clostridium difficile infections and severe diarrhea. Patients should report any persistent or severe diarrhea during or after treatment. Interactions with other medications. Keflex can interact with certain medications, such as probenecid, metformin, and anticoagulants, blood thinners. It is essential to inform your healthcare provider about all medications you are taking to avoid potential interactions. Precautions for specific populations. Keflex should be used with caution in pregnant or breastfeeding women, as it can cross the placenta and enter breast milk. Patients with kidney or liver impairment may require dosage adjustments. It is crucial to discuss any concerns or potential risks with your healthcare provider before starting treatment with Keflex. Alternatives to Keflex. In some cases, alternative antibiotics may be considered if Keflex is not suitable or if the infection is resistant to cephalosporins. Some potential alternatives include amoxicillin or amoxicillin clavulinate. These penicillin-based antibiotics are often used as alternatives for respiratory tract infections, skin and soft tissue infections, and certain urinary tract infections. Macrolides, e.g., azithromycin, clarithromycin. Macrolides are commonly used for respiratory tract infections, particularly in patients with penicillin allergies. Fluoroquinolones, e.g., ciprofloxacin, levofloxacin. These broad-spectrum antibiotics may be prescribed for urinary tract infections, respiratory tract infections, or skin and soft tissue infections. Trimethoprim sulfamethoxazole, TMP-SMX. This antibiotic combination is often used for urinary tract infections and certain respiratory tract infections. The choice of an alternative antibiotic depends on various factors, including the type and severity of the infection, antibiotic resistance patterns, patient allergies, and individual risk factors. Conclusion. Keflex is a widely prescribed and effective antibiotic that plays a crucial role in treating various bacterial infections. Its broad-spectrum activity, oral administration, favorable safety profile, and cost-effectiveness contribute to its popularity. However, it is essential to use Keflex judiciously and follow your healthcare provider's instructions carefully to minimize the risk of side effects, antibiotic resistance, and other potential dangers. If you have any concerns or experience adverse effects while taking Keflex, it is crucial to consult with your healthcare provider promptly. Remember, responsible antibiotic use is key to preserving the effectiveness of these life-saving medications for generations to come. If you or a loved one are experiencing symptoms of a bacterial infection, don't hesitate to seek medical advice. Your healthcare provider can determine if Keflex or another antibiotic is the appropriate treatment option for your specific condition. Remember, early and proper treatment can help prevent complications and promote a faster recovery. Stay informed, follow your healthcare provider's instructions, and prioritize your health and well-being.